Hi, I'm Kelsey McGinty. I'm doing my physical assessment on my patient, so here we go. Alright. Hi, what's your name?
Courtney.
Courtney. How old are you, Courtney?
25.
25. Do you have any present health illnesses or anything right now? No? Okay, good. Do you have any allergies?
No.
No? Let's see. Any history of any illnesses or anything?
I had strep throat as a kid and mono.
Okay. Any adult illnesses?
No.
No. Okay. Have you had any hospitalizations or surgeries?
I had orthodontic jaw surgery
Okay.
in 2008.
Okay. All right. Have you had any accidents or injuries?
No.
No. Are you up to date on your vaccinations?
Yes.
Okay. And what kind of vaccinations are you up to date on?
Flu this year, Tdap 2010, and Hep B this year.
Okay. When was your last physical exam?
This year.
Okay. Have you had any chest x-rays?
Last year.
No. Okay. And why did you have your chest x-ray?
Breathing problems.
Breathing problems. Okay. Have you had a pap smear anytime soon? Or
February.
recently, I'm sorry. Okay. Alright. Any EKGs or any heart things? No. And a TB test? Okay. Had that this year?
Yes.
Okay. Alright. Do you have any gynecologic history or anything?
I had a child in 2010.
Okay. Are you on birth control now?
Yes.
Okay. Alrighty. Any STDs?
No.
Yeah, good. Alright. What about your family? Does your family have any health history that you know of?
Mom has hypertension.
Okay.
Dad, hypertension, diabetic, anxiety.
What about your grandparents?
One grandpa, COPD, smoker.
Is he still around?
No.
Okay.
Grandma, lung cancer. She's still alive.
That's
She's
good.
a smoker. Other grandpa, obesity, chronic neck pain. And then grandma, leukemia and heart valve replacement.
Okay.
She passed away.
Yeah. Do you have any siblings?
27-year-old sister.
Okay. Does she have any health history?
Nah.
Alright, dear. How tall are you?
5'9".
Okay. And how much do you weigh?
150.
Okay. How's your diet? Like, typical? Like, what did you have today?
Breakfast was cereal and milk, pizza for lunch, and pigs in a blanket, baked beans, and mac and cheese for dinner.
That's good.
800 cc's of water.
That's good. Awesome. Okay. Alright, so it sounds to me like you speak English. Do you speak any other languages? No?
No.
Okay. And let's see, and we're pretty proficient in reading and writing and everything. Okay. Alright. Do you have any religious beliefs?
I'm Catholic.
Okay. How important is that to you?
I don't attend church.
Oh, okay. Are there any special beliefs or practices that would be helpful for us? Okay.
No.
Do you use any like alternative treatments for healing?
No.
Is there anyone that you would like us to turn to if you do get sick?
My parents.
Okay. Alright. Can you just describe your family for me?
Well, my parents have been married for 28 years. I have a sister and a daughter. Get along pretty well. We all live separately and we see each other often.
I'm still going over your health history with you. Do you have any like skin history?
No, not really.
What about your exposure to the sun?
I go out in the sun, but I don't go tanning bed or anything.
Okay. No odd moles or anything like that? Okay. Do you have any like issues with your head? Any like headaches or dizziness or anything like that?
Headaches sometimes when I haven't ate or slept.
Do you have any problems with your eyes or anything?
Contacts.
Oh, okay.
I wear contacts.
Any problems with hearing or anything like that? Or any pain?
No.
No. Any issues with your nose or anything? Or like sneezing or nothing like that? What about your mouth and all that? I know that you said that you had that jaw surgery, but have you had any problems with that? No. And your neck, do you have any issues with that? No. Okay. Back again about the heart. Do you have any heart issues? Any chest pain or hypertension that you're aware of? No. Okay. Any peripheral, anything going on with your legs?
No.
No. You're pretty easy. Any like respiratory issues, like coughing, sneezing, anything like that lately? Okay. What about your stomach? Do you have any issues going to the bathroom, or do you have any nausea, vomiting, anything like that? How often do you have bowel movement?
Every day.
Every day. Pretty regular.
It's the way to be.
Urinary wise, any problems using the restroom in that sense? How often would you say that you go to the restroom?
Probably about 5 or 6 times.
Oh, okay. Do you have any like musculoskeletal issues like pain or arthritis or anything like that?
Nope.
No. With your central nervous system, do you have any like seizures or hallucinations or anything wild like that?
I don't think so.
Do you have any endocrine wise? Do you have anything going on with like weight change or any hormone issues? No. All right, Miss. I'm gonna ask you a few more questions. Education wise, do you have a degree, or have you been to college, or?
An associate's degree in nursing.
Okay. How would you describe your financial status?
Stable. I own a home.
Okay. That's good. And you're Catholic?
Yeah.
Okay. Activity and exercise, do you work out anytime?
I try to.
You try to? Okay. And would you say that you're independent in your daily living?
Definitely.
Okay. Alright. And sleep-wise, how's your sleep pattern?
Well, I work nights, so it's kind of scattered whenever I can get some rest.
Alright. Do you take naps during the day, or?
Definitely.
Okay. I guess that's depending on your work schedule.
Yes.
Okay. Do you take anything to help you sleep, like medications or anything?
No.
Okay. I'm just going to talk about some of your relationships with your family. Do you have, what would you say that your role is with your family?
Probably a leadership role.
Okay. And same with your friends?
Mm-hmm.
Okay. Do you belong to like any organizations? Now you said that you're a nurse. What kind of role would you have at work?
RN on an oncology unit.
Would you say that you have a lot of stress in your life?
Yeah, normal from work and relationships.
Yeah. What would you say helps you with your stress?
Probably sleep and family time.
Do you have any personal habits like using tobacco or drugs or alcohol? Do you have any like environmental health hazards like at work? You said you work on oncology, so.
Yeah, there's chemo and radiation, lifting people, needle sticks.
Yeah, all the regular stuff. At home, do you have anything to kind of protect you guys at home?
The smoke detector and carbon monoxide detector.
Okay. Do you say that you live in a pretty safe neighborhood? Is there
Yeah.
anything to help you with that?
We have neighborhood watch.
And do you travel often or anything? No. Alrighty, Miss Courtney. Now I'm going to go ahead and just do your physical assessment, if you don't mind. Alrighty. I'm gonna just kind of look at your skin. Okay, looks good. Yeah, looks good. I'm gonna just kind of feel you. You feel warm to the touch. You feel good. I'm gonna check your turgor. Do you have any like edema, any swelling in your feet or anything? No edema, no lesions, no open wounds or anything. No. Okay. I'm just gonna take a look at your nails real quick and just kind of see your color. All right, looks good. All right, now I'm gonna look at your head and your face. I'm just gonna palpate your head, the size and the shape. Yes. I'm just gonna hold it here. Alright, great. Her face looks pretty symmetrical. Let's see. Your nose, it's symmetrical, mouth symmetrical. All that. Alright, I'm going to palpate your temporal artery. And I can feel both of them super easy. Let's see. I'm just going to palpate your sinuses. I'm just going to kind of look at your hair color. It looks like you have good hair. It's thick. Look good. Alright, Miss Courtney, can you smile for me? Can you frown? Can you show me your teeth and blow out your cheeks? Thank you. Can you raise your eyebrows? Can you tightly close your eyes? Thank you. And can you tell me, I'm going to touch places on your face, and can you tell me where I'm touching you?
Okay. Forehead.
Alright.
Cheeks. Chin.
Awesome. Good. Alright. Now I'm just going to look at your eyes. Alright, and I'm just going to do a curler with my fake little flashlight. Looks good. Looks good. Alright, can you follow my fingers? Okay. And don't move your hand. Alright, here. Thank you. Let's see. Everything looks good there. I'm just going to look at your ears if you don't mind. Right, now I'm going to do a little whisper test. Do you want to turn around? Sorry. Alright, I'm just going to whisper in your ears and just tell me what I say. I love school.
I love school.
Also, you passed. I'm just going to look at your nose. Just going to see your color. You're pretty symmetrical. And I have to palpate it. Feels good. Alright, and can you breathe out and just taste in your patency? Alright, both look good. Alright, now I'm just going to inspect your lips. Just look pretty moist. They look good. Symmetrical. No lesions or anything. I'm just going to ask you to smile. Oh, sorry. Look at that for me. Alright. You have all your teeth. They look good. Let's see. Do you mind to kind of let me see your gums? They look good. Do you have any like bleeding or anything when you brush? That's good. Alright. And I'm just going to ask you to open up. Like, wow, I'm just going to look at your palate. It looks good. Alrighty. I'm not going to palpate your tongue because I don't have any gloves. But do you mind to stick it out? That's good. Alright. I'm just going to inspect your neck now. Are there any masses or any tenderness that I should know about? Alright. Feels good. Alrighty. Just going to kind of palpate your shoulders and your arms, if you don't mind. Are you tender or anything?
Mm-mm.
No? Okay. Right. And can you move? Oh,
I'm swimming.
right. I need to palpate your thyroid. Can you swallow for me? Oh, okay. And your trachea, the midline. All right. Now I'm going to look at your upper extremities. I've already inspected your color. It looks really good. Can you do a little shoulder shrug for me? Awesome. Okay. No pain or anything when you do that? Okay. Can you turn your head? Like, I'm going to put my hand here just for resistance. Can you turn your head against my hand? Okay. And this one too. Thank you. Let's see. Can you move your elbows and your fingers and your wrists and everything? Awesome. That's full range of motion there. And I'm just going to palpate your pulses there. Actually, really easy. Okay. Those are easy to find. Just going to inspect the palms of your hand. Nice temperature. The skin color looks appropriate. I'm going to just kind of test your sensation, so if you could just kind of close your eyes, I'm just going to, you tell me which hand I'm touching.
Left. Right.
Okay, yeah, that's good. Alright, I'm just going to look at your chest wall, nice and round, nothing. And your posture's good when you're breathing. Let's see. Do you have any tenderness or anything in your chest? Okay, I'm just gonna palpate all over you. I'm
I'll get a tip.
sorry. Sorry. Alrighty. Right, and I'm just gonna listen to you real quick. Can you take a deep breath in for me? Thank you. And again, please. Thank you. And again. And again. And again. Do you mind turning on for me? Oh, that's fine. Thank you. Can you take a deep breath in for me? Thank you. And again. Thank you. And again. And again. And again. And again. Thank you. Alrighty. That sounds good. I just have to pinch the skin over your sternum to check your turgor. Thank you. I'm sorry. Thank you. Alright, that was good. Let's see. Just gonna look at your ribs. Sorry. Looks good. Alrighty. Now I'm gonna look at your neck vessels. I'm just gonna fill in your jugular, just one at a time. That feels good. Alright. Good. Alrighty. I'm gonna listen to your chest again. I'm just gonna listen to your heart. I'm just gonna kind of get under here. Sorry. Everything sounds good. I'm just gonna listen to your stomach now. You don't have any lesions or anything or any rashes on your stomach?
Mm-hmm.
I'm going to look at your stomach real quick. That's okay. Everything looks good. Does it hurt when I touch you or anything?
Uh-uh.
Okay. I'm just going to listen to your bowel sounds. Your belly button looks good too. Alrighty. Now we're just going to kind of look at your lower extremities. Do you have any like varicose veins or anything like that down there?
No.
Okay. Oh, okay. Alrighty. Now I see that you're pretty muscular. Your feet look good. Let's see. Just gonna note your hair distribution. Let's see. I'm just gonna palpate the joints of your hips and test your range of motion. You just kind of kick up the leg. Oh, it's okay. I'm just gonna palpate your femoral pulse bilaterally.
Ooh.
And it didn't seem that you had any edema or anything like that. Your temperature was good. Now I'm going to palpate your knees. On your knees up, I guess. I'm palpating your knees. And I'm going to palpate your ankles. This is so weird. Alright, feels good. Range of motion is good. I'm going to just look at the capillary refills of your toenails.
Mm.
I'm sorry. Everything looks good. Now we're just going to do some neuro and musculoskeletal parts of this. Do you mind to turn around? I'm just going to look at your spine. Do you mind to bend over a little bit? Everything looks good and in line. Do you mind if I see you walk up real quick? Just make sure that your gait's steady. Alrighty, you can come back. Thank you. Thank you. Did good. You had your good arm swing and posture. Alright. You seem pretty balanced. And that is about it. So, thank you, Courtney. I appreciate your help.
You're one of the best nurses I've ever had.
Thank you. I appreciate it. Alright, and thank you guys.